Can PTSD and autism exist together? Of course. Consider how dual diagnosis might impact the presentation of behaviors and symptoms. So we can talk a lot about what autism is and what trauma is, but when we're talking about both together, we're talking about yet a third thing. So how do we do that? How do we start to understand which is which, what is what, and how those things come together? I'm just going to talk about this briefly because I know not everybody here is an evaluating psychologist, but doing things like clinical interviews has to go beyond the child and the caregiver in the room. It has to include teachers, doctors, babysitters, whoever the family feels are important people in the child's life. So that might mean a grandparent, that might mean a neighbor. But having some faith in our families that they are experts on what's happening, and so they can refer to whomever might have some input. Is there observing the person in different environments? So again, we can talk about these symptoms a lot, but if we don't see some of those things, we might not be able to have all that information. And furthermore, symptoms change, characteristics, behaviors change, depending on the sensory input of the room, depending on the social dynamics, depending on if mom or dad are there or not, depending on if I've been here before and something bad happened. So being able to see them in different environments can give us a lot of information. Considering the limitations of our testing materials. I do evaluations for a living, so I have a lot of positive feelings about testing materials. But this is an environment, this is a specific niche that is near impossible to provide testing materials that's going to meet the needs of every aspect of that person. And that is a huge limitation we have in our field, and something that anybody who's doing assessments needs to remember. That I am not familiar personally of measures that are normed on both autism and trauma together. Some are very specific for autism, some are very specific for trauma, and we don't get a lot of that overlap, much less things like cultural differences, racial differences, educational differences. And we do know that some with autism respond to questions on items in a more literal manner or struggle with emotional awareness, and that's going to impact their responding as well. It's also important to collaborate with other professionals, knowing our own limitations. And I think somebody mentioned this morning, part of an assessment might happen with a speech therapist, part might happen with a neurologist, part might happen with a psychologist. So being able to collaborate and all come to the table with our own perspectives is crucial for the family. And keep in mind too, that some of our testing measures aren't going to highlight what may be perceived as traumatic, because the general population might not always perceive it that way.